everyone. I really welcome you all in our day 5 of Lippincott series, and today we are going to solve some more questions. So you can see on the screen. So let's read the question number 1. The nurse is managing care of a primary gravida at full term who is in active labor. What should be included in plan care of this client? So read all the option. What can be the right answer? So answer number 3 will be the correct. Anesthesia पेन लेवल असेसमेंट एवरी 30 मिनट्स बिकॉज अगर कोई पेशेंट है जो एक्टिव लेबर के अंदर होता है तो उसको पेन मैनेजमेंट और एनेस्थीसिया का लेवल हमको चेक करना चाहिए ताकि पेशेंट को डिस्कम्फर्ट ना हो. Let's read the next question. The HCP prescribed intermittent fetal heart rate monitoring for a 20-year-old obese primary gravid client at 40 weeks of gestation in the first stage of labor. The nurse should monitor the client's fetal heart rate pattern at which interval? So, on which interval we have to check the fetal heart rate? So, answer number 2 will be the correct. Every 30 minutes during the active phase, we have to check the fetal heart rate. Now, let's read the next question. A primary gravid client at positive 1 station and 9 centimeter dilated. Based on the data, what should the nurse do first? So read all the option. What can be the right answer? So answer number 3 will be the correct. Encourage the client to breathe through the urge to push. Now let's read the next question. Assessment of a primary gravid client in active labor who has no analgesia or anesthesia reveals complete cervical effacement dilation of 8 centimeter and fetus station at 0 station. The nurse should expect the client to exhibit which behavior during this phase of labor? So read all the option. What can be the right answer? So जो भी सारे सिम्टम्स या फेसमेंट से हमको पता लग रहा है कि जो क्लाइंट है वो ट्रांजिशन फेज में है. So usually इस phase के अंदर the patient exhibit loss of control. So answer number 2 will be the correct answer. The nurse is explaining to a primary gravida in a labor that the baby is in breech presentation. With the baby's presentation part is left sacrum LSP position. Which illustration should the nurse use to help the clients understand how her baby is positioned? So here are some position you can see. So कौन सी पोजीशन ऐसी है जो कि प्रॉपर ब्रीच प्रेजेंटेशन शो करती है? So here answer number 1 will be the correct, that shows breech presentation. Now let's read the next question, question number 6. The nurse is discussing pain relief method for a pregnant first time mother. The discussion should include which labor support methods. Select all that apply. We have to choose labor support methods. So answer number 1 will be the correct, that is fluids. That means light massage हम patient को कर सकते हैं. Answer number 3 will be also correct, guided imaginary. What else? 4 and 6 will also be correct to support the patient. Let's read the next question. A primary gravid client at 38 week of gestations come to the labor room because by water broke. The HCP asked the nurse to verify spontaneous rupture of membrane using a nitrogen paper. The nurse should observe that nitrogen paper turns bright blue. Which action should the nurse take next? Read all the option carefully. What can be the right answer? So answer number 1, notify the HCP that the membranes are ruptured. कैसे पता चला membrane rupture हो गई है? Because वो paper nitrogen paper alkaline water की वजह से blue turn हो जाएगा. Now let's read the next question. The HCP has prescribed prostaglandin gel to be administered vaginally to a newly admitted primary gravid client. Which findings indicates that the client has therapeutic response to this medication? What are therapeutic response of prostaglandin gel? Read all the options. So ये gel basically जो cervical brightening के लिए use होते हैं, तो answer number 3 will be the correct. Softening of cervix and beginning of effacement. Next question says, a primary gravid client is admitted as outpatient for an external cephalic version. Which factors should be contraindicated for this procedure? Read all the options. सो व्हाट इज एक्सटर्नल सिफेलिक वर्जन? ये ब्रिज प्रेजेंटेशन को चेंज करने के लिए होता है, जिससे हम ब्रिज प्रेजेंटेशन को चेंज कर सकते हैं. तो किसके अंदर कॉन्ट्राइंडिकेटेड होता है? मल्टीपल गेस्टेशन के अंदर. Let's read the next question. A primary gravida is admitted to the labor area with rupture membrane and contraction occurring every 2 to 3 minutes, lasting 45 seconds. After 3 hours of labor, the client's contractions are now 7 to 10 minutes, lasting for 30 seconds. The nurse administers oxytocin as prescribed. What is the expected outcome of this drug? पहले कॉन्ट्रेक्शन ज्यादा थी, उसके बाद कॉन्ट्रेक्शन कम हुई, तो हमने ऑक्सीटोसिन दिया. सो ऑक्सीटोसिन का क्या आउटकम आएगा? रीड ऑल द ऑप्शन, लेट मी नो द राइट आंसर. Answer number 2 will be the correct. Contraction will occur every 2 to 3 minutes, lasting for seconds with moderate intensity, resting between contraction. Next question. A primary gravid client in second stage of labor feels to urge to push. The client had no analgesia or anesthesia. What would be the best position for this client to assume? That will help the patient in labor. What will be the best position? Answer number 4 will be the correct, that is squatting position. Next question. A 21-year-old primary gravid client at 40 weeks of gestation is admitted to the hospital in active labor. The client's cervix is 8 centimeter and completely effaced at 0 station. During the transition phase of labor, what is the priority nursing problem? You have 4 options. Let me know the correct answer. So in transition state, we have to look for pain. So answer number 4 will be the correct. Now next question. A 24-year-old primary gravid client who gives birth to a viable term unit is prescribed oxytocin IV after delivery of the placenta. Which sign would indicate that the nurse placenta is about to deliver? So read all the option. What can be the right answer? So it's not difficult to answer. Answer number 1 will be the correct. The cord length outside the vagina. 14th question. A primiparous client who had just given birth to a healthy term unit after 12 hours of labor holds and look at the unit and begins to cry. The nurse interprets this behavior as a sign of which response? Read all the options. Disappointment, grief, a normal response to the birth, indication of postpartum blues. What will be the correct one? The correct answer will be 3. Normal response to birth. 15th question. The cervix of 15-year-old primary gravid client who has been admitted to the labor area is 2 centimeter dilated and 50 centimeter effaced. Her membranes are intact and contraction are occurring every 5 to 6 minutes. Which intervention should the nurse do at that time? Read all the options. So what can be the right answer? सो आंसर नंबर 3 विल बी द करेक्ट. अगर क्लाइंट वो कर सकती है तो इस कंडीशन में हम उनको वो करने के लिए बोलते हैं अर्ली स्टेज ऑफ लेबर के अंदर. Next question 16. Which technique to promote active relaxation would the nurse include in teaching plan for 16-year-old primary gravid client in early labor? Read all the option. What can be the right answer? Relaxation involved body muscle during the uterine contraction will be the right answer. The nurse is performing fluids for a primary gravid client in early labor. Which technique should the nurse use? So फ्लैट इज बेसिकली अ मसाज टेक्निक जिसके लिए हम यूज करेंगे लाइट स्ट्रोकिंग ऑफ स्किन सरफेस. लाइट मसाज हम देते हैं अपनी फिंगर से स्किन सरफेस पे पेशेंट के. So we will use this technique. Now waiting question. A 24-year-old primary gravid client in active labor requests the use of jet hydrotherapy tub to aid pain relief. Which condition would the nurse consider to be contraindication of hydrotherapy? So you have four options on the screen. Read all the options and let me know what will be the contraindication of hydrotherapy. That is rupture membranes. Now 19th question. The HCP prescribed an amniocentesis for a primary gravid client at 37 week of gestation to determine fetal lung maturity. Which is the indicator of fetal lung maturity? इनमें से किससे हम पता कर सकते हैं कि fetal lungs are mature or not? Read all the options. Answer number 4 will be the correct answer. LS ratio, that will be 2:1 if the lungs are mature. Next question 20th. A 19-year-old primary gravid client at 38 week of gestation is 7 centimeter dilated and presenting part is at +1 station. The nurse tells the nurse, I need to push. What should the nurse do next? Read all the options. So answer number 3 will be the correct. Instruct the client to use a pant blow pattern of breathing. Because तब तक फुल्ली डायलेशन नहीं होता सर्विक्स का, हम नहीं बोल सकते पुश करने के लिए. तो पुशिंग अर्ज को कंट्रोल करने के लिए हम क्या इंस्ट्रक्ट करेंगे? इंस्ट्रक्ट द क्लाइंट टू यूज अ पेंट फ्लो पैटर्न ऑफ ब्रीदिंग ताकि उसके जो पुशिंग अर्ज है वो रिड्यूस हो सके. एंड आफ्टर फुल डायलेशन वी कैन आस्क द पेशेंट टू पुश. Let's read the next question. What will be the priority when caring for a primary gravid client whose cervix is dilated at 8 centimeter, when the fetus is at +1 station and the client had no analgesia or anesthesia? So read all the options and let me know the correct one. There is no analgesia or anesthesia, so we can offer encourage and support because transition phase है labor का, so we have to encourage the mother. Now, next question. To determine whether a primary gravid client in labor with a fetus in left occipital anterior position is completely dilated, the nurse perform a vaginal examination. During the examination, the nurse should palpate which cranial sutures. All of this, which suture is easily palpable during vaginal examination? That is sagittal suture. Next question. After a lengthy labor process, the primary gravid client give birth to a healthy newborn boy with a moderate amount of skull molding. Which information should include when explaining the parents about this condition? Read the option carefully. What can be the right answer about skull molding? Answer number 2 will be the correct. It usually lasts a day or two before resolving. It will resolve after 2 days. We can tell this to the parents. Next question says, HCP has performed the labor, informed the labor nurse that he believes the uterus has inverted in a primiparous client who had just given birth. Which findings should help to confirm this diagnosis? It's a SATA question. So select more than one option that will confirm the inverted uterus. So what can be the right answers? Hypotension, because in यूट्राइन इन्वर्जन की वजह से सडन गश ऑफ ब्लड विजाइना से आ सकता है जिसकी वजह से बीपी ड्रॉप हो जाएगा. व्हाट एल्स? सेकंड, गश ऑफ ब्लड फ्रॉम विजाइना जिसकी वजह से क्या होगा? हाइपरटेंशन होगा. नेक्स्ट इज फिफ्थ, इनएबिलिटी टू पाल्पेट द यूट्रस. नेक्स्ट विल बी डायफोरेसिस. सो ये सारी कंडीशन क्या डायग्नोस करती हैं? द फीमेल हैज इन्वर्टेड यूट्रस. Let's read the next question. The nurse explained to a newly admitted primary gravid client in an active labor that, according to the gate control theory of the pain, a closed gate means that the client should experience which type of pain? No pain, sharp pain, light pain, and moderate pain. What about the closed gate theory? It means no pain. Let's read the next question. The cervix of a primary gravid client in active labor who received epidural anesthesia 4 hours ago is now completely dilated and the client is ready to begin pushing. What is the most important for a nurse to assess before the client begins to push? It is bladder status. बिकॉज अगर ट्रांजिशन फेज में या फिर मदर अभी बर्थ देने वाली है वो पुश कर रही है उस टाइम पे अगर ब्लैडर फुल है तो इट कैन कॉज द प्रॉब्लम्स. सो वी हैव टू चेक द ब्लैडर स्टेटस. 27th question. For the past 8 hours, a 20-year-old primary gravid client in active labor with intact membrane has been experiencing regular contractions. The fetal heart rate is 136 beats per minute with moderate variability. After determining that the client is still in the latent phase of the birth, the nurse should observe the client which problem. Read all the options. What will be the correct one? Answer number 1 will be the correct. Usually अगर एक्टिव लेबर ज़्यादा लंबा चला जाता है काफ़ी टाइम से मदर जो लेबर के अंदर है उससे क्या होगा? वो एग्जॉर्ट हो जाएगी. इसलिए हम एग्जॉर्शन को थक गई है नहीं असेस हमको करना है. Now, next question. A primary gravid client whose cervix is 7 centimeter dilated with a fetus at zero station in a left occipito anterior position has severe back pain. Which intervention is most indicated in severe back pain? Read all the options. What can be the right one? So answer number 1 will be the correct. Provide firm pressure to the client sacral area because लेफ्ट ओसिपिटो पोस्टीरियर पोजीशन के अंदर बैक पेन हो रहा है उससे एफेसमेंट जो होगी मतलब बेबी के हेड की वो सैक्रल पे प्रेशर डाल सकती है तो उस टाइम पे पेन रिलीव करने के लिए हम फर्म प्रेशर जो है सैक्रल एरिया पर देंगे. Now next question 29th. A primary gravid client in active labor has no anesthesia. The cervix is 7 centimeter dilated. She is starting to feel considerable discomfort during contraction. The nurse should instruct the client to change from slow chest breathing to which breathing technique? 4 options on the screen. What can be the right one? So answer number 1 will be the correct, that is rapid shallow chest breathing. 30th question. Assessment of primary gravid client reveals cervical dilation at 8 centimeter and complete effacement. The client has severe back pain during this phase of labor. The nurse explained that the client's severe pain is most likely caused by fetal occiput being in which position? So which position causes severe back pain? That is posterior position. So answer number 3 will be the correct answer. So occiput of posterior position के अंदर है infant baby, तो वो क्या होगा, मदर को ज़्यादा पेन होगा. Now next question. The nurse assess a primary parent's client with rupture of membrane in labor for 20 hours. The nurse identifies late discoloration on the monitor and indicates standard procedure for the client with this wave pattern. Which instruction should the nurse perform? It's a SATA question for late discoloration. So late discoloration का मतलब oxygen reduction. Administer oxygen via mask to the client, placing the client on her side, and fifth one, applying the internal fetal monitor, जिससे हम fetal heart rate को assess कर सकें. Now 32 question. When performing Leopold maneuvers on a primary gravid client, the nurse is palpating the uterus as shown below. Which maneuver is the nurse performing? So look at the image. Which maneuver is performing? So these are your options. So what will be the right answer? Look at the image again and read all the options. That is third maneuver. Before placing the fetal monitoring device on a primary gravid client's fundus, the nurse performed Leopold's maneuver. The nurse explained that third maneuver is done for which reason? So read all the options. What will be the correct one? So answer number 1 will be the correct, to determine whether the fetal presenting part is engaged or not. So let's read the next question, that is 34. The nurse is caring for a G2T1POAO L1 client at term. The client is completely phased, dilated to 2 centimeter with contraction every 3 minutes lasting for 45 seconds. The client is asking for an epidural to make her more comfortable. Indicate the appropriate response by the nurse. So you have 4 options on the screen. Read all the options. What can be the right one for epidural anesthesia? So answer number 4 will be the correct. It's too early in a labor for epidural anesthesia, but you can have the medication to keep you comfortable until you have dilated 3 or 4 or more. So 2 centimeter के dilation के अंदर हम anesthesia recommend नहीं करते. Now let's read the next question. The nurse has just received report on a client labor at G3T1PO AB1L1 who is 80% effaced, 3 centimeter dilated and 0 station. The nurse anticipates the plan of care for the shift will address which factors? It's again a SATA question and you have to select more than one option. So you have 5 options. So 1, 2, 4. Will 5 will be the answer or not? This client will withdraw to herself during transition. Yes, 5 will also be the answer. So this will be the answer of this question. Let's read the 36th question. A multigravida in active labor is 7 centimeter dilated. The fetal heart rate baseline is 130 beats per minute with moderate variability. The clients begin to have variable discoloration to 100 to 110 beats per minute. What should the nurse do next? In variable discoloration. So variable discoloration किस 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 वजह से हो सकती है? कोड कंप्रेशन की वजह से भी हो सकती है. सो इस कंडीशन के अंदर वी विल रिपोजिशन द क्लाइंट एंड कंटिन्यू टू इवेलुएट fetal heart rate will be the correct option because it will get normal by repositioning the client. Now let's read the next question, that is 37. The nurse is preparing a change of shift report and has been carried for a multi-gravid client with a normally processing labor. Which information should be the part of this report? It's again a starter question and you have to select more than one option. So answer number 1 will be the correct interpretation of fetal monitoring strip, analgesia or anesthesia used, support person with the client, prior history of birth will be taken. Now next question. A multi-gravid client is admitted at 4 centimeter dilation and requesting pain medication. The nurse gives the client an opioid agonist anesthesia. Within 5 minutes, the client tells the nurse that she feels like she needs to have a bowel movement. What should the nurse do first? If she saying she wants to do a bowel movement, complete a vaginal examination. Because अगर वो ये बोल रही है she wants to do bowel movement, it means कि प्रेजेंटिंग पार्ट हो सकता है, सर्विक्स डायलेट हो सकता है, मे बी वो ट्रांजिशन फेज में हो, तो इसके लिए हमको चेक करने के लिए विजाइनल एग्जामिनेशन करना है. Now let's read the next question. A 31-year-old multi-gravid client at 39 week of gestation admitted to the hospital in active labor is receiving intravenous ringer lactate solution and continuous epidural anesthesia. During the first hour after administration of anesthesia, the nurse should monitor the client for which adverse effect. Read all the option. What can be the adverse effect of anesthesia? सो anesthesia पेन रिडक्शन के लिए देते हैं जो कि वेजोडाइलेशन भी कर सकता है, that can result in hypotension. So let's see the next question, 14th. A 30-year-old G3T2POAO-L2 is being monitored internally. She is being induced with IV oxytocin because she is postterm. The nurse note the pattern below. The client is wedged to her side while lying in a bed and she is approximately 6 centimeter dilated and 100% effaced. What should the nurse do first? So, see these strips. इससे हमको क्या पता लगता है? These shows late discolorations. So what we need to do? You have four options. We have to discontinue the oxytocin infusion in this condition if we have late discolorations. So let's see the next question. The nurse assists with the precipitous birth in an outpatient setting. While waiting for more advanced care, the nurse places the infant skin to skin with mother and encourages breastfeeding. What are the desired outcome of skin to skin care with early breastfeeding? Select all that applies. So what will be the right one? Answer number 1, 2, 3, and 4, that says beginning the parental infant bonding process, preventing neonatal hypothermia, providing glucose to neonate, Contracting the mother's uterus. Let's read the next question. Approximately 15 minutes after the birth of a viable term unit, a multiparous client has chill. What should the nurse do next? Read all the options and let me know the correct one. So the right answer will be provide the client with a warm blanket because she feels chills. Let's read the next one. The HCP plans to perform an amniotomy on a multiparous client admitted to the labor area at 41 week of gestation for a labor induction. After the amniotomy, what should the nurse do first? So you have four options on the screen. What can be the right one? सो एमनियोक्टमी की कुछ कॉम्प्लिकेशंस होती हैं जैसे कि कॉर्ड कंप्रेशन हो सकता है, कॉर्ड प्रोलैप्स हो सकता है, जिसकी वजह से फीटल हार्ट रेट हमको असेस करने चाहिए कि फीटस को कोई प्रॉब्लम तो नहीं है. सो वी हैव टू असेस द फीटस हार्ट रेट फॉर फुल 1 minute आफ्टर एन एमनियोक्टमी. So now let's read the question number 44. A multi-gravid client whose 10 centimeter dilated is admitted to the labor and birth unit. In addition to supporting the client, what is the priority nursing action? So you have four options on the screen. What will be the right one? The cervix is 10 centimeter dilated. So answer number one will be the correct one. क्योंकि हम प्रिपेयर कर रहे हैं बर्थ के लिए. 10 सेंटीमीटर अगर सर्विक्स डायलेटेड है, दैट मीन्स द मदर इज रेडी टू गिव बर्थ. सो इसलिए हमको पहले प्रिपेयर करना है इन्फेंट वोमर. Now let's read the next question. The nurse is assessing fetal presentation in a multiparous client. The illustration below indicate which type of presentation. So look at this image. This show which type of presentation. So you have four options: flank breach, complete breach, floating breach, vertex. So the most common breach presentation is flank breach. So let's read the next question, that is 46. 2 hours ago, a multi-gravid client was admitted in a active labor with her cervix dilated 5 centimeters and completely effaced, and the fetus at zero station. Currently, the client is experiencing nausea and vomiting, a slight chill with perspiration, breathes on her lips, and extreme irritability. What should the nurse do first? So read all the options and let me know the right one. So these are symptoms of transition phase. So what we need to assess the client's cervical dilation. So answer number 4 will be the correct one. Now let's read the question number 47. Which interval should the nurse use when assessing the frequency of contraction for a multiparous client in active labor admitted to the birthing area? So read all the options. What can be the right one? So to assess the frequency of client's contraction, what we need to do, we have to assess the contraction in beginning of one contraction to the beginning of next contraction. 48th question. While a client is being admitted to the birthing unit, she states, my water just broke last night, but my labor started 2 hours ago. Which findings are most concerning? Select all that applies. So answer number 3 will be the correct. Fetus heart rate of 140 beats per minute with a range between 160 with contraction. 4 will be the correct. Pre-pad stained with green fluid. Answer number 5 will also be the correct line, stating the baby wants out, he keeps kicking me. Now let's read the next question, that is 49. While the nurse is caring for a multiparous client in active labor at 36 weeks of gestation, the nurse tells, I think my water just broke. What should the nurse do first? In this case, there will be gushing of fluids if the water just broke. So the umbilical cord may be get out of the vaginal canal. So sudden discoloration baby को हो सकता है. So what we need to monitor? Assess the fetus heart rate pattern. Now last question, that is 50th. The nurse has obtained a urine specimen from a multiparous client admitted to the labor unit. The woman asked to go to the bathroom and reports that she feels she has to move her bowels. What action would be appropriate? It's again a starter question. You have to answer one more than one answer. So answer number 3 will be the correct one. Assessing her stage of labor. What else? Answer number 6 will also be the correct. Checking the degree of fetal descent. कितना ज़्यादा fetal descent हो चुका है, कितनी देर में हम बेड करा सकते हैं. So it was all about today's session, and in next class we will discuss some more questions.